So we've got a piece of work that we're hopefully going to be helping them, as well as publishing at CCG level, to publish that at local authority level, so that we can answer different questions of the data. But then also we might be able to go down at a much more granular level, maybe to ward level, if possible. So we'll keep you posted on that and let everyone know how we're doing on that, because obviously geography is fascinating and difficult all at the same time. So and we need the different levels of questions to be asked there. Before we just go through some of the work we've done, are there any burning questions that people would like to get into the room or share with us? If you just raise your hand, we'll go to you now. Otherwise, we'll go on to Patrick Lake, who's going to go through some of our data resources that we've put together. Great stuff. So, Amy, have we got any hands raised? No. Excellent. So, Patrick, I'm going to stop sharing my screen now. If you wanted to share your screen and take people through the work we've been doing on trying to put good data in the right place.
Yeah. Can you see my screen? Yeah.
Yeah.
Yeah. Yeah. So, like Paul was saying, we've got the hub page here, and at the bottom there's a link to a data page, which is just some key stuff I've been putting together from what people have contributed. So this is powered by our Google document. So if you click this, it's got a list of data sources here, so anyone can contribute to this. And I think what people are finding particularly interesting is the granularity of the data. So what area does it cover and how fine detailed is it? Is it local authority data, clinical messaging group? So there's a field for that, which would be really helpful for people to fill that in. People can quickly find what they need. And that just powers this data hub page. So we'll be updating this with our own data, but also with whatever anyone else adds. I'm aware there's quite a lot of links in here as well, so I'll be adding those to the page as we go on, and anything that comes up in the chat I'll be adding to that. So, yeah.
Excellent. Are there any questions or comments on that, or immediate things that people would like to share? Please do. Oh, hello.
Hello, can you hear me?
Yes, we can. Yeah. Hi.
Sorry, hi. I'm outside, so I might be a bit noisy, but I'm Claire from Northern Power Grid, and
Hi,
what the data that we'd be interested to have, and I haven't seen it shared yet, is any improvised structure that is getting organized, such as pop-up hospitals or factories that are converting to producing PPE materials. The reason is that we'd like, as an electricity infrastructure provider, to make sure that we provide the right resilience for the network there and backup plans in case there's a power cut. So I don't know if that's data that's held nationally or at the council level, but it's the type of data that we'd be interested to have.
Okay, just so that's, let me play that back. So that's Northern Power Grid. You would like to make sure that there are no power cuts for the new resilience or the new installations that are being put up. Alistair at NHS Digital. Is that a question we can put direct to the NHS to help share that data, so that Northern Power Grid to make sure that they've got the right power for those new installations that are going up?
Yeah, so I'm just trying to think about who the best person to go to. So we've got an estates team that collate data for physical hospitals and stuff, and I'm wondering if they're getting the feeds for the new field hospitals and capacity being built out. I don't know off the top of my head, but I will fire off an email now and see if I can find out So who just asked? Sorry, I missed the name. I'll get back to you.
So that was Anne Claire from Northern
Claire.
Power Grid. If Amy, if you can take a note, and we'll make sure that Anne Claire and Alistair are connected, and we do that. And then obviously that data set will be relevant to all power providers across the country. So it's a question I'm sure they're all being asked.
Yeah. See, what I'm not sure is how data for the new stuff is flowing, whether that's coming into NHS Digital or NHS England. So that's what I need to find out, because you probably know the NHS has a lot of different organisations in it. But I'll do my best. I'll do some digging and get back to you.
And also it might be that we could make that an open question, and if someone else finds it and it gets connected via the magic of the web, that's cool as well, isn't it? So Amy, if you could take that as a use case on the Google Doc, and then maybe we'll stick that out on social media straight away, and then other people can share it. And if that gets answered and published openly, that'll be really good, because
that's excellent. What we're after as well is so on top of any new health organisation, factories that might have converted to producing PPE. So I know, for instance, in Castleford, Burberry has changed from building trench coats to manufacturing masks. That's also the type of information we're after. Might come from councils, might come from news articles that people read. But
okay,
I'd like to collate that too.
Great. Okay, that might be something we take offline, and is a how do we make sure that the hard infrastructure is supported by data infrastructure to make sure that we don't fall over on this. So I think that's a really good use case that could be transferred to a lot of infrastructure that's out there that doesn't move as fast as maybe we as other parts of the economy does. So Amy, if you could take that as a use case, we'll do that. Fantastic. And Claire, is that everything, or is there anything else? Is she still there? Don't know.
She's still there. She's unmuting. No, thank you. That's all. Thank you.
Amazing. Thank you very much. Is there any other quick points that people want to make? Otherwise, we'll move on. I think what we'd like to do is maybe... Okay.
There's a question on the chat from Graham.
Great stuff. Graham, would you like to make ask the question?
Yeah, I think.
So, Graham, who are you? Where are you from? Just so everyone knows.
Oh, you know me, Paul.
I know you, but let's make sure everyone else does. Yeah.
So my name's Graham Hyde. So I have a joint role between Leeds City Council and NHS Leeds, primarily helping the formation and development of local care partnerships. So in Leeds and nationally, there is a coming together of primary care into primary care networks, but then in Leeds we're kind of going one stage further and expanding that role and identity to things called local care partnerships to involve all stakeholders around a population, so housing, adult social care, third sector. So I'm kind of doing a bit of that. But one of my questions at the moment, I've been privy to some person level data in Leeds around there's the nationally constructed list of about 1.5 million people that NHS England have created, and I'm led to believe there's about 14,000 people in Leeds that are on that list, and actually then they've all been written to or texted, and in there there's an option to say contact this number or contact this website if you absolutely need support. So I've seen that data and been doing a bit of work to geocode that and provide that back to teams within Leeds to do stuff with. But we're just thinking about other data sets in Leeds, and to cut a long story short, my question to NHS Digital is that the COVID-19 symptoms questionnaire on the website, it does ask for a user's full postcode, So, you know, I get the looking at data at ECG and local authority level and potentially ward level. But is that data, you know, what are the barriers to releasing that data at kind of person level? So that's my big question.
So releasing data at person level obviously is generally very hard for GDPR and data protection reasons, right? We can't put that into the public domain. So what we have to do is we have to apply suppression and disclosure control. So if we talk about the shielded patients, which I think is what you're talking about, that list, so that was generated by a team in NHS Digital. So we're going to, next week is the target to get an open data set out for that will be aggregated by local authority, CCG. We're hoping for some lower order geographies, but we need to get that balance right. So very similar to the 111 data that went out a few days ago. That is based on patient level data or user data, they're not patients necessarily. We can't just release that as it is, so we have to aggregate it and we have to apply some suppression rules. So for the vulnerable patient list data, is the VPL data set, so we're looking at releasing the national cut of that, and we're hoping to get it by GP, local authority, CCG at the bare minimum, because the populations mean that's not disclosive. And then we're sort of looking to see if we can get some lower order geographies. That might not be in the first release, because each round of extra detail means extra IG, means extra reviews, and it means delay. So the strategy we're taking is get something out there that's safe and then build out. So with the 111 data, for example, at the moment, that's all out by CCG. We're looking to get a release out by local authority. And we just going through some of the complexities around that. But at least we can do that because we've got the granular data behind the scenes. Does that make sense? So the only row level, patient level data sets released at the moment by the NHS is prescribing. And that's because prescription data, the numbers are so vast, it's actually quite hard to pick somebody out. And even then, certain drugs are removed, for example, for HIV and stuff, which is fairly rare and highly sensitive. Does that make sense? As a sort of happy to have a detailed chat.
That makes perfect sense, but operationally and on the ground, is there an alternative method to getting hold of this person record level information? Because that would be absolutely immense if we could start to have that feed. I'm quite of the opinion that GDPR can almost do one at the moment, because we're talking about people's lives here.
So hang on, what are we talking about? Are we talking about data going to the open domain or providing patient level lists to specific organisations providing care or planning? Second one. Right, so that's different, right? So I'm talking about not open data. We have to, by the way, the second one's you're covered by legal directions. So I was actually talking to somebody about the flows for SPL this morning. So that's led by Kieran Baker, who is my boss. I think the flows, because they're updating it at the moment, so I think that's going to be going to local authorities, Cabinet Office, NHS England, and some others. I can dig out that detail if you want. So those are the people who will be getting the patient level clear data used for medical and planning purposes and stuff. And that's so led by Kieran Baker, and a guy called Richard Irvin's actually leading the technical team. I can connect you if that's useful, if that helps you.
I think we're possibly got lots and lots of lists of lots and lots of different people, so just trying to kind of merge into one list, because we don't want to miss anybody. You know, there's a huge volunteering effort in Leeds that people are starting to phone up people or you know, make contact with them, and we just don't want to miss anyone from all of these lists. So trying to add a UPRN number to some of the data as well, so that we can try and start unique link up, certainly in Leeds.
Cool. I'll drop an email out, link you with Kieran, because I know there's a new release of that, the vulnerable patient list. It's going out today or tomorrow, I believe, because there's been a change in the methodology due to some of the conditions, and then it's going to be released weekly going forward from that point onwards. But I'll connect you and we can.
Brilliant, thank you.
Just to follow up from that, Graham, I think if you were able to put that use case into the Google Doc, I know that a lot of people are using that Google Doc to drive workflows where in all of their teams. So that would be really great. And then I think what I'm not sure if the Red Cross team are on the line today, but last week they went through they're building a really great tool around vulnerability indexes, I think at ward level across the UK, as an initial cut. And we're trying to push people when they're looking at measuring vulnerability, directing resources, maybe to use that Red Cross tool and help support that Red Cross tool to be the best it can be, rather than lots of different ones across the country. So we're trying to take any vulnerability work out of what we're doing and pushing it towards the Red Cross team who are working on that data. They've got a repo, they've got all of the stuff set up. So that is in the document, but also Amy will, if you can put that link in the chat now, people can see it. I think that'll be a really useful thing that we could all do, is to direct people who are working on vulnerability to the Red Cross work. So yeah, great.
Sorry, very quickly if we've got time before we move on, we've got Peter Wells who has a question or comment, and I believe Nicholas Garrett in the chat said he wanted to follow up on something that Graham was saying as well.
Great stuff. Peter, do you want to go first, and then we'll go to Nick? You're on mute.
I fixed it.
Yeah. Yes.
Good. So just one comment on vulnerability, which I think is quite an important comment I've seen missing. So I've been looking across, doing a bit of a scan across the country on some of what's going on. One important thing I'm seeing, which NHS Digital did really well in the shielded patient list, is understanding that you're always going to miss someone. Because there's always going to be an imperfection in the data. There's always a risk that a place is missed. And they've articulated that in the data set really well. And they're building feedback loops into the services to get to the point of, we know we're going to miss someone, therefore we're open to that happening and we're open to making it better. So just a reinforcement of that point will be useful to people making decisions based on that data. I'm on mute again now.
Nick?
Just to reinforce what Graham's saying, I'm leading the community support group, which is providing food and community support to people. And we approached the ICS and we'd approached the GPs.
So Nick, is that in North Yorkshire?
It is. Yeah, we approached the ICS and we approached GPs to put our telephone number in so people could actually ring us to sort out their shopping and food and things. And they just didn't do it. So I think what Graham's asking for is really needed, because now we have people vulnerable and isolated and not knowing how to get hold of stuff, and because they've been told to shield. So it is really, really important to get that to community, that to mediated through local government to community groups that can actually support these people, because it is, Graham's right, it is a safeguarding issue now, actually, because people can't eat. So you have to think about how GDPR actually comes up against safeguarding policy with that.
Yeah. Okay, Nick, again, what I'd say is if you can put that into the Google Doc, I think the more that we generate these priority use cases will really help teams that Alistair's doing and the other data pods and whatever we have within the NHS to make sure that they understand people's priorities. So it's making locally relevant stuff and build on those priorities. So that's exactly why we wanted to set this up, so that we can get those priorities to the people who are working on stuff straight away. Okay. ODI Leeds team, is there any other hands up, any other points?
No specific ones, so I think we're good to move on.
Great stuff. So one of our work streams we do significant about is looking at data, trying to build useful tools off the back of the data that's published. And you may have seen the global index that the FT's been doing of looking at the deaths and infections across the globe and comparing people, and lots of comment about how do you measure a log scale and how do you present a log scale and how do you, so it's, we had a really great session yesterday about how we might help people understand the data. And then by showing a tool, it might drive better data to be published so we can all understand and plan a little bit better. So I'm going to ask Stuart, who runs and builds a lot of our data projects at ODI Leeds, to run through our very rough prototype that we've been building. So over to you, Stuart.
So yeah, if you just scroll up slightly, get a title in.
Yeah.
So we were trying to make some things for local authorities. So the first idea was to do a local authority version of the Financial Times graph showing cases with time since there were 10 cases reported. So it's very rough and ready at the moment. I've not got a y-axis labels yet, and it's on a linear scale. I'm going to make it so you can switch between linear and logarithmic scale, and just to have a sort of more localized view. I don't know how useful it's going to be for people, but if anyone from local authorities has ideas for things that they would like to be able to drill down into data sets at a local authority level, we can try and coordinate it all on that page. There's a GitHub repo for it, so you can make issues on there and contribute if you want to.
So is that our GitHub repo, Stuart, or Tom White?
Yeah, we'll share the link.
Put our GitHub repo in the chat.
Yeah, so the data for that comes from Tom White, who's trying to collate data across the UK, because each UK nation is publishing things in different places, and they're not all publishing in a nice way. Some are doing it in PDFs or via Twitter or things like that. So Tom White's trying to bring it all into one place for the whole of the UK. If there are errors in there, which, like Peter was saying before, there can be errors, things will be wrong. You can always update files and send a pull request to there to improve the data. Unfortunately, Wales doesn't seem to have local authority level data anymore. If you look at Tom's notes, and they stopped reporting that. But for England, there's local authority or upper tier local authority rather data. Scotland has NHS board, and I think Northern Ireland has something like that as well.
And then what we're looking at doing is to, once we've got the data in some sort of shape for each local authority, is to try and present their rate of change. So is it doubling every 2 days, every 3 days, every 4 days, so that people can understand what's happening as soon as possible. So please do join in with how we're looking to try and publish or present the data that's available, and please join in. There'll be our GitHub repo on the tracker soon, and also we can raise issues on that. But also, if people are looking at it, if you could encourage them to just share what they'd like to see now, maybe put it in a Google document or share with us on Twitter. We'll try and get something up and running by next week on this. And then as more data is published,
I'll try to add filtering tools and things so that you type in your local authority and it'll narrow down the graph for you more in a much more user-friendly interface. And I only started this at the end of yesterday, so it's very bare bones.
Yeah,
but and I'll try and make it so it saves in the URL if you've selected a local authority, so that you can share a link to that particular local authority's view. There's a question from Nick in the chat saying, could this be cut at primary care network level as well as LA? I don't know the answer to that. I don't know primary care network geographies and if data's being published at those. If anyone else knows, let me know.
So Nick, could you share with us what is a primary care? Because I understand CCGs, I understand local authorities and water. So this is another geography that's...
Yeah. Well, there's people better qualified than me on the call to answer that question, especially Graham. Well, actually, Graham, can you let Graham answer this one? Because he knows the answer.
Do it. Graham, tell us what a primary care network geography is.
Okay, so PCNs are a coming together of GP practices that basically are in a similar area. So in Leeds, we have 19 primary care networks who are typically looking after about 35 to 50,000 people within their area. So, for example, we have a Seacroft PCN, a Armley PCN, a West Leeds PCN, and that's really, GP practices coming together to work together for populations.
Okay, Alistair, and there's definitely something about geography coming up here about how we present this, how and what's useful. We've had a number of chief execs come to us and say, could we get it at local authority level, which is obviously useful for them to track their performance against others and also talk to each other, saying, look, you may be 2 weeks ahead of us or 10 days, or we're past this, so they can start to share knowledge. I think there's there'll be something around geography that a short working group, if something spun out of this, a bit like vulnerability, where we could try and build on the data that's being published. So you publish it at CCG level first, but then I guess there's a number of other columns we need to add to that data: local authority, ward, PCN, CCG, that people then can start to use the data, what geography makes sense to them. Yeah. So I guess it's an open question to the call. How would people be willing? I'm sure they would be willing, but how do we collectively share that? Do we just put it in a Google Doc and you'll take that on, or do we do a little bit more, have a separate call and about geography? Don't know. I guess that's a question to you, Alistair. How would you like us to feedback to your teams so that you can publish data with the right geography?
So it'd be good to know what geographies want and why, so I can sort of use that to build, just prioritise the work internally. So maybe Google Doc as a first push, and if it's easy to do, we'll do it. If there's specific questions, then it'd be good to know who to go back to. So I guess geographies people are interested in generally, then for specific open data sets, so be it 111 SBL or whatever else comes out next. And then maybe follow up if needed. Because I think we're trying to get it's sort of prioritising what we need to do really. But yeah, so it's for people to say what they want and then what their priorities are. So what would they most want next week, for example? That would be fantastic.
So Graham, I think do you want to make a point there?
Yeah. So the only world that I currently know is Leeds, and in Leeds we've got 33 wards, and each ward is coordinating the volunteer effort for kind of food and support. So ward definitely seems to be our geography of choice at the moment in Leeds, but that person level stuff is still critical, and the linking. I think certainly not for open data, but certainly if we're releasing and getting stuff at person level, how do we link all these people together?
And for you,
okay,
is it postcode that you get multiple people in postcodes?
I think there's something there about when on the data spectrum, when open data stops and when shared data between organisations doing safeguarding kicks in. So I think there's and I think if you get the right people on the call and make a decision, that could be done. Once it's done in one place, it should be done for the rest of the country. So I think there's maybe a very quick governance call that we can do that could cut, if we get it right, could cut across a lot of wailing and gnashing of teeth, I guess, of that if someone makes a decision and they're willing to stand by it, that then is something that other people can rely on in the future, and we don't have to make that same decision 700 times over and over again.
Yeah, and just to say, at the moment in Leeds, it's kind of the calm before the storm. So things are quiet in inverted commas, but people that I certainly spoke to yesterday, they're just putting their plans in place because they know what's coming, or they think they know now is a good time to get stuff available.
Yeah, so and for you at that ward level for local planning, it is that patient level stuff you need, don't you? Really, do you need the vulnerable people? Because there's two types of vulnerable people. There's obviously sort of very vulnerable people, and then there's people who should be social distancing, so milder asthmatics, etc. Are you interested in both?
Or you more critical and the vulnerable? I think.
Yeah. I think the answer is yes.
Yeah, it is.
It's always just give me the data. You know, that's all us geeks always say. And I totally get where you're coming from the centre, Alistair. I totally get it.
It's I'm still fairly new, so I'm 7 months in, but I think it's working out what we can do first and quickest. But no, that's good then. Cool.
Just to add to what Graham's saying, because Graham's quite rightly thinking for Leeds that at ward level data works, and having worked in Leeds, I know exactly where it's coming from. Graham also lives, I think, in Harrogate, so we know that where you've got a county and a district split, they don't often work at a ward level.
Okay.
And a post-COVID in a post-COVID world, PCNs are going to be the ones who are actually driving population health management, place-based management of health. And so getting them involved now, and getting the data level to them now will save you so much time working with PCNs after this is finished, because you're getting them used to working in this post-COVID way where they're actually managing the health of the population. So actually giving them the data at the right level now is going to make the transformation of the NHS so much, well, not so much, a little bit easier.
Okay, cool.
That's cool. Sorry, go on.
Excellent. Okay. So I think we've done.
From Laura.
Oh, Laura's.
Yeah, I was just going to say there's a couple of questions in the chat. There is actually one from earlier on that I'd just like to bring up first, if that's okay. From David. So I think it's a fairly general data question. Is UK reporting on total recovered cases of COVID-19? And he cites a data source that says the UK is only showing about 135 recovered cases. Is this data being gathered at a local level?
Yeah. I come in to add to that. Thanks for raising it. There seems to be a gap here because the UK is clearly under-reporting. That figure hasn't changed for a few days. As the pandemic goes on, the number of recovery cases will actually become more important. At the moment, what's being reported is cases and deaths. But being able to look at the ratio of recoveries, particularly at local level, will become more important to look at the efficacy of treatments, but also the demand for support services and so on. So I'm just I think that the local authority tracker you've got is great. I just wondered, at a local level, is there a source of information about recovery cases? Because it seems to me it's a gap, and it's an important gap.
Okay, yeah, that's I guess that's a data requirement, isn't it? Yeah.
Yeah.
I'm going to add your query to the Google Doc. But is there anyone would like to take that on now?
It's a PHE thing, I think. So they collect that data. I don't know if we've got any contacts there.
They collect it. If they collect it, they don't report it.
Okay, cool.
I think they collect it. I'm not sure. I need to check, but just trying to think who. I don't have any contacts at PHE.
Yeah. So David, that brings me. I think that's a really important question, and something that we can use the collective power of the people on this call and the network around. So I think if more than one person asks that question, it will help us create a demand for it. There's also I don't know if you've seen the symptoms tracker app by the NIHR and UCL and a number of others people. I don't see anywhere where that data is being published. Graham might know where it's being published, or if it is going to be published, but an open data set of that that we could visualize or other people could use would be amazing, and we should demand that we get that. So Graham.
Yeah, there was an email, I want to say Monday or Tuesday, where there was, as you can imagine, all sorts of forms and hoops that people had to fill in to get this data. And it's just give me the fucking data.
Why wouldn't that be published openly? I don't understand.
I don't know. I don't know the answer to that question. But we're certainly looking at it as another data source of stuff. Basically, the triangulation of all these different data sets.
So Peter's got his hand up, and I'm going to ask him to jump in. But I was wondering whether if everyone here would like to join in with a collective request for that data to be appropriately anonymized, obviously, but it published. And we could obviously help get that published with the right anonymisation and protection and licensing, maybe we should just offer to help. Don't know, Peter.
So yes, that data should be open. At a certain level, should be open. Obviously, I just remind people that the NHS 111 and telephone data about symptoms is being published now as of yesterday.
Yeah.
So that's been published by NHS Digital, who are doing great work on that. I understand that they are talking with the Join Zoe people to get a common standard and get that data published too. But more calls for it will always help.
Yeah. They should just publish it, and then I'm sure a standard will emerge. One of my personal favourites is, we can't do anything until we agree a standard. And then 5 weeks later, nothing's happened. Or maybe 2 years later, nothing's happened because reasons. So
absolutely. But in the meantime, grab that NHS 111 data because it looks really good.
Yeah. So we're going to do that and big up that. And I think if everyone can join in with our call, which will go out later today and tomorrow for the Join Zoe data to be published openly, and we'll be saying, why isn't it open now? It's not beyond the wit of man. And we have this thing called the interwebs, which we could all collaborate on and get a common standard done in about 30 seconds, or maybe 15 minutes. that common standard could get agreed. But yeah,
you could always use in these exceptional times as a catch-all to getting stuff done and shifted on.
Yeah,
it works for me anyway.
Good. Well, I think in these exceptional times, ODI Leeds will make a request to the Join Zoe people and say, why hasn't it been published openly already? And let's see where we go with that. And if people could help us, obviously in a very polite way, but if people could join us on that, that would be amazing. And David, your point around the recovery cases, I think we'll be maybe putting 1 or 2, 3 things that come out of this call upon online and sharing that as well, because that's very important. And it also helps with people's state of mind as well, if they can see the numbers of recovered cases exponentially increasing as well, which would be very important. I know it will be to my mum. So, and I can show her a picture saying.
Before we wrap up or move on, just to return to questions from the chat.
Yes. There's 2 more questions, isn't there? Yeah.
There's Laura who's asking about the tracker and asking which new user needs it responds to. I'm assuming it's to the ODI Leeds tracker.
Laura, if you just want to share with us what the question, and then we'll try and answer it.
Hi. So I'm new here, so thank you for the great job that you are doing. I was checking the Google Doc and I noticed that you were listing the user needs. So I just want to make sure that we are responding to those user needs by creating data for them. So when I saw the tracker that you just showed, I just wanted to know which user needs we are addressing, because there are so many things that we need to present data and then we need to show. But as a service designer, we always choose whatever the user needs so we can create a greater impact. So that's why I was asking what they
absolutely.
Came from.
So I'll take this. This is 2 personal conversations I've had, one with Tom Reardon at Leeds City Council, who's the chief exec of Leeds City Council, and also with Theo Blackwell, who's the chief digital officer at the London Mayor's office. They both had the specific requirement of trying to understand at local authority level where they were, a little bit of historical performance, and also where other people were across the country so they can compare themselves, but also pick up the phone to people who might be ahead of them so that they can track how they deploy their resources and plan. So it's 2 specific user needs that are coming out of local authority senior management of how they plan for this over the next 1, 2, 3, 4, 5 weeks, and then maybe in months. And then the other part that comes out of this is that you may have seen the hex map that we produced of the data that's been published by NHS Digital. People
Public Health England.
there's a Public Health England data. So we'll share that in, I'll just share that in a second, but we got a lot of positive feedback about that. But it also generated a whole load of user needs of people saying, this is great, but could we have a bit more detail? Could we have a bit, could we put the data in one place? And I think that user needs is lots of people are having meetings where they just are struggling to present data meaningfully and have conversations around it. And that could be in many different levels. So they're the two user needs that we're helping with that. It's about local government trying to plan and manage their resources for the next few weeks and then months in the future. So in fact, I'm just going to share my screen so people can see the hex maps.
Thank you very much.
So we've got our hex maps. This is our initial hex map. That we're building, and we're hopefully going to build a few more, a bit more functionality and add more data to it. So you can see here that Bradford's total case is 95, population this. So you can see how useful this would be as a static data set.
It's filtered. That's filtered by normalized to population. If you at the top, Paul, if you change it to cases, so the published data is cases, which makes Birmingham look very bad compared to everywhere else. But when you normalize it by population, Birmingham isn't when it's per capita.
So this is us trying to help people just visualize the data and make it a little bit easier to understand quickly. And then if you put the hex map alongside the tracker, you can then see, okay, we've got some total data where we can compare ourselves. And then we've got the graph which shows the rate of change. And then that's 2 bits of information that people have requested from us already. And then hopefully there'll be some more stuff that comes along that other people might build on the data. So you might have the dream is to have a sort of distributed set of tools and resources that people can use as they go.
No, this is awesome. Thank you very much for sharing.
No problem. No problem. Amy, what was the question?
We have Jamie Saunders from Bradford has raised his hand.
Over to you, Jamie.
Cheers, Paul. Morning, everybody.
Hello.
Just 2 quick bits, really. We're doing policy side research. There's a whole load of stuff that's coming out from government in HTML and PDF that's causing all sorts of fun and games about tracking what the current state of play is, but maybe we'll pick that one offline. The other one is Phil Witchley is doing a lot of work around data and KPIs and tracking. And just to think a little bit more widely of COVID-19 as being not just about morbidity and mortality and the medical data, but then the indirect effects of COVID-19. So related issues around mental health, domestic violence, those other metrics that help local authorities suss out what the wider impacts of this crisis are would be really useful for many of the other people in the room. And I suppose one of the ones that has been flagged this week is around universal credit data and getting that through DWP as quick as we can, just to track what the trend is, particularly around self-employed people and what support needs to be made available for a health perspective as well as a financial and economy perspective. So I think that bit about this is much wider than just the NHS and medical data sets. We need to just think about putting a package together for chief execs and leaders and the like. Thank you.
Okay. No problem. Nick, you've got a point.
Yeah, just like to support that, that package. We've already begun to think about some of the wider health issues, particularly around falls. We've got vulnerable people staying in their house more, so we're anticipating that falls data, people falling, frail people falling is going to go up. So it's really going to help with the prevention agenda to have that data and have it quickly.
Okay, we're already talking about what happens next, which is great. So I think if, as we say to everybody, if we're creating assets and resources people can use in the future and when they're ready. So every time people make a point, if they could, Jamie, if you could add that to the Google Doc, you're much better at describing what you said there. Nick, the point around falls data would be really good if you can put it in the Google Doc, and then that really helps us all have an asset and a resource for when we need it in the future. So that's great. Okay, Amy, have we picked up everyone's questions in the chat?
There's literally one just come in now from Mike.
Hey, Mike.
So it's a question about the hex map. He said, is there an equivalent for the deaths data?
Okay. Is the death data
potentially
published?
We can,
yeah.
If it's available from Public Health England, I can't quite remember what they had, but if it is, and I can always try the version from Tom White instead, so I can try and add a tab for deaths as well.
That's published by the ONS.
Yeah, exactly, and I think that's Mike. Do you want to just share where do you work and what's the requirement for deaths and how you might use it? I'll mute you.
Different mic, I think.
All right, okay. Oh, we've just got Mike on the line. So, Mike, if you again, if you could expand a little bit on the Google Doc about why you need that, and that'll be great. But we will be adding more data sets to that hex map so that people can see different data regionally at a level that people understand. Yes. Mike's got no audio. No worries. Amy, did we pick everything up?
I believe so, yes. So there's some really good links and resources that have been shared in the group chat, which I can transfer over to the Google Doc or onto the resources part of the website. But as far as I can see, there's no other questions in the chat, and there's no raised hands as yet.
Good, with some great. I think Alistair's just let everyone know that he's creating an open data hub for health data. So I think this is amplifying and accelerating that work, I guess, Alistair.
Yeah. So before this hit, we wanted to create a bit of a hub to bring together documentation of people using NHS digital data, how it's been combined with other stuff. So, and selfishly, it gives us good use cases so we can build better open data sets, but also so it's useful for the community. So Jess Aitken just join us to help build that out. So if anyone would like to take part in a bit of user research around that, appreciate things are massively hectic, but we're hoping to, as Paul said, use this to accelerate things. So we can get the data out there, but also get more collateral around how to use that data, because I think we could do better there. So just a shout out, really.
There's a guest blog post on our website explaining all of that. So everyone on this call, if you we'll put Amy, if you could put a link to Alistair's blog post on the chat. That's on the ODI Leeds website. It's talking about this, and I think we're always looking. My glass is always half full. So if this helps become a cohort to support Alistair build the right open data hub against actual use cases, rather than hopeful publishing of data that might be useful, would be fabulous.
Cool. Thank you, Paul.
No problem. This is all part of the service. Okay, so yes, the Open Data Health blog is there on our on the chat. Please watch out for more development of the Open Data Saves Lives stuff. If you want to use that hashtag and the COVID-19 yourselves and do smaller groups, I think we're seeing stuff generate around vulnerability, around geography, around the request for person-level data and also open data. I think we are definitely working at a local level, but it would be nationally relevant as well. And I think the more we can do in these sort of informal sessions will definitely help us amplify and accelerate some of the formal conversations we know are happening. So thanks very much for joining. If you want to get in touch, please do. watch us on Twitter and online and on all the other feeds for the work we're doing. And if there's anything specific you think we should look at, please send that through to us. And then we'll be sharing it with our partners over in Manchester at Open Data Manchester. Peter Wells has been putting us in touch with the team up in Newcastle. So I did spot some of the Newcastle team on there from their urban dashboard. I think Luke was online. Is he still there? I don't know. And also our links with the beautiful info team at in Kent CCG as well. So please watch this space, join in, and we'll make a massive difference. So thank you. See you later, everyone. We'll do this again next week, and keep on keeping on, I guess. All right, take it easy. Thank you. If the ODI Leeds team could just stay on, we'll just have a quick wash up.